Hi, you guys. I am so excited that y'all came and are here to spend a little bit of time with me today. So excited. I do want to be super respectful of y'all's time, so we are going to get started on time. Um, I am hoping you guys can all see my screen. Um, Let me just make sure everything is set up the way that it should be. It looks like it is. Let me do one thing really quick and then we'll get started. Okay, cool. So I want to first say thank you again for being here. I want to welcome you. I want to share a little bit briefly about how Modern Thyroid Clinic got started. And if you guys have followed me for long, you very well might know this story. Um, just making sure everything looks good because I cannot, um, let me see. I'm going to reclaim host really quick and see if that worked. Um, Perfect. Okay, good. That did work. Amazing. Okay, everything looks great. So I want to talk to you a little bit about how we got started. Modern Thyroid Clinic really is my professional baby, and it came about from my own story of pain to purpose. So when I was 27, I had my own thyroid issue and was literally bedbound outside of work. I was non-functioning, hardly got by at work, didn't really function in my relationships, spent every waking moment outside of my job in bed. Um, I was already being treated for a thyroid condition. I had already moved from levothyroxine to Synthroid, went to my doctor, absolutely begged for help, and was met with the same kind of storyline that so many of you are, which is I'm only going to check your TSH. I'm not going to check a full thyroid panel. Your TSH is low, your fatigue, your brain fog, your weight gain, your low libido, your depression, your hair loss, your high cholesterol. It's your problem. It's not a thyroid problem. Your TSH looks fine. Bye. And literally, I would cry as I left his office and felt so hopeless and didn't even feel like I had the capacity to find another alternative because I was so low functioning. Eventually, I found a physician, a clinician, almost a year later that helped me get my life back, very quickly became a mentor to me. And I dug deep and went into every rabbit hole that I could on progressive thyroid care. And that is how Modern Thyroid Clinic started. My goal is to create a safe place for people who have been repeatedly gaslit, rejected, told that they're fine, told that they're normal, made to feel like their symptoms are literally all in their head or their own fault. I wanted to create a place that could successfully treat even the most complex thyroid disorders. And I wanted to find a place that you guys could feel comfortable, like you were partnering in your health journey and that you were empowered to be able to make decisions on your health journey. So that is what we are about at Modern Thyroid Clinic. I want to share with you a review that popped up not even, I don't know, a week ago, maybe 2 weeks ago. And it's by a very dear patient named Gina. And, she is not my patient. She is Hillary's patient, but I do treat one of her children. She says, I've struggled with thyroid issues for many years. I also had my thyroid removed 9 years ago. I'd heard from other doctors, this is just the way that you are. You're tired because you're a mom. You're getting older. You're not getting enough sleep. You need to move more. You need to eat less. Exercise and you'll be fine, right? I'm sure so many of you have heard that story. She felt completely hopeless. I was 100 pounds overweight and could not lose it. And she had tried so many things. And then she found Modern Thyroid Clinic. My life has completely changed. I've lost 95 pounds and I have my life back. My energy is back. I feel like myself again. I've also sent 2 of my kids to see clinicians, and they've also been able to get their lives back as well. It's been over a year now with MTC, and the money I've spent there is priceless to me. I appreciate McCall and Hillary so much. They have saved my life and my family's lives, and I cannot thank them enough. And honestly, Gina had even a harder story than most people who come to see us. Almost a decade post-thyroidectomy, those people generally are unable to ever live a normal life again. So I want to tell you that there is hope. There is so much hope. And I know that you guys are stuck in this feeling that there isn't, that there is no way out, that this next thing isn't going to work, and that Modern Thyroid Clinic is just like everywhere else you've always been. And it works for everyone else, but it's not going to work for me. Those are all the fears that everyone has when they come here. And those same exact people go on to get their lives back and thrive and not like survive in life, but actually get to enjoy it, enjoy their family, enjoy watching their kids grow up, enjoy their job, not just struggling to literally be out of bed every day like I was. So I want to tell you a little bit about what we're going to talk about today, kind of give you a lay of the land and agenda. I will not go over an hour. I really want to be respectful of y'all's time, and I so appreciate you joining me to just be here. So I want to talk about what we do differently, right? I want you guys to leave here understanding what sets us apart so that you can make a true, informed, and empowered decision to know if we are the right clinic for you. We want to help people. We want to help people that we can help, and we want to help people that want us to help them. We are not trying to just bring anybody and everybody in. We want to make sure it's the right fit for you. I want you guys to know if be able to determine if we're the right fit for you before leaving today. I want you to have an idea of logistics and pricing, questions that I get all the time, like on social media. And I do have a special, unique offer to share with you guys. Y'all know if I know you've been here for a while, because the only people that we offer this to are people who are on our email list, and we don't really run specials. We don't really offer discounts, but you guys are going to get one today. And then I want to answer y'all's questions. So you guys submitted some in advance of this webinar, and I want to be sure that I cover all of those. But I also want to take questions from you all. So let's begin. So why is Modern Thyroid Clinic different? What makes us different? There are a few things, okay? So there are multiple other companies out there who are doing telemedicine for thyroid, et cetera. Y'all, we are not even remotely close to them. Like we are completely different. Um, and so a few things that make us different. One is obviously we run full thyroid panels, right? We do not just run TSH or TSH and T4 like your endocrinologist, like your primary care doc. We run complete thyroid panels. You guys hear me preach about this all the time and the value of that. And you guys, I'll tell you just so that you guys know, but I share this information widely. TSH, free T4, free T3, reverse T3, and Hashimoto's and Graves' antibodies in each respective case. But it's what we do with that information that really is powerful, that sets us apart. So our optimal, not normal ranges are not the ranges of anyone else. You will never find our ranges being used in another practice unless they directly took our ranges from us, which again, I freely share because I want people to have access to good thyroid care. I want people to be able to get their lives back. At the end of the day, if it's not with us, I want you to be able to get your lives back anyway. So I freely share all of this. But what I want you guys to know is this did not come from a book. It didn't come from a training. It didn't come from functional medicine practices. It is our own. And we arrived at optimal ranges in a very specific way. And what I think so many people don't know, because honestly, I didn't even know myself, but you all have to be in perfect thyroid ranges or you are miserable. Okay. And I didn't know this. Like, had you asked me this 10 years ago, never would have believed it. But I describe thyroid function like a light switch, and it is an on-off switch. It is not a dimmer switch. So it does not matter how close or far you are outside of perfect range. If everything is not perfect, the light is off and you are tired and you are fatigued and you are gaining weight and you have a low libido and all the classic things. Okay. Nothing else matters. Everything is perfect. Everything is tightly controlled and you thrive, or it's not. One little deviation and you suffer. So our ranges initially, almost 10 years ago, started out like a normal functional medicine range. Like, okay, well, here's the quote normal range. Let's trim a little bit off the top. Let's trim a little bit off the bottom. Let's narrow it down by about 25%, 20% on either side. And that's where we're aiming. And that is still what functional medicine people do to this day. Integrative medicine people, people who have a more progressive approach, that's the algorithm they're using. I admire them for trying to help people. Like, I'm so grateful that their heart is in the right place, but they're not equipped. Okay. So we started there every 12 to 18 months for almost 10 years. We have taken that initial range and based on our own data of where do our thyroid patients feel good? Where do they not feel good? And 100% of our patients are thyroid patients. So we have access to a lot of data. We narrow those margins every 12 to 18 months until now. I think our last shift was about 2 years ago. We are left with ranges that are this wide. And even functional medicine ranges are as wide as the rooms that we're all sitting in. It is night and day different. We have been able to perfect where people need to be based on real data in real time of where people do not have thyroid symptoms anymore. Okay, which is pretty darn powerful. Call me biased, but it is. So that is something that makes us very, very unique. Obviously, too, we use progressive medications, right? We do not put people on levothyroxine, Synthroid alone. We don't have any patients on what are called T4-based medications alone. So these are meds, levothyroxine, Synthroid, Tirosint, Levoxyl, Unithroid. Those are all inactive hormones, all T4, and they are dependent on your ability to activate them. And guess what? If you're on this webinar right now, you either don't activate that medication well, or you don't activate your own endogenous T4 well, because you can have all the T4, all the inactive hormone in the world, but if you cannot activate that hormone, you are not ever going to get your life back from your thyroid problem. So we specialize in balancing both T4 as well as T3. So inactive and active, again, to perfection. These hormones have to be perfectly managed. You need the right med at the right dose at the right time. It's not as simple as, oh, well, someone put me on desiccated thyroid. Now I'm supposed to feel better and I don't. This must not work for me. No. I give an analogy of like diabetic people, right? Like if someone is a type 1 diabetic and they need insulin, right? They can't just get put on insulin. They need the right amount of insulin at the right dose at the right time for their diabetes to be managed. It's the same thing with thyroid. Okay. So very, very important. And another big factor that makes us very, very different than other people is the way that we harness the power of these medications. So you guys have all had this experience. You go to the doctor. They're like, okay, you have a thyroid problem. We're going to start you on the lowest dose, 25 micrograms of levothyroxine, and we'll see what happens. So you wait 3, 6, 9 months, you get labs, you go back, and they say, oh gosh, it looks like maybe you need more thyroid medication. We're going to increase you to the next dose up. You rinse and repeat 1 dose up, 1 dose down based on your labs for your entire life. Okay. So it's just, let's make a change and we'll see what happens. Let's make another change. We'll see what happens. That is not the way that we do things. Okay. We collect data in a, admittedly, neurotic way. Like every single variable is controlled. And why we do that is because if we start with good, solid, clean, stable data, we are not guessing. We are not waiting to see what happens. We know with almost a 0.2 variance of each of your labs where your labs will land at your next appointment. Okay. What that means is 1, we're not guessing, and 2, we can take you so much farther with every treatment cycle. So instead of making 1 change at a time, what happens even at your first appointment with your clinician at Modern Thyroid Clinic is we increase you in small microscopic dose increases over almost a month. Sometimes it's 3 weeks, sometimes it's 5 weeks, depending on your starting point. So that basically we give you a tiny bit of medication, we allow you to adapt. We give you more, we allow you to adapt. So people leave essentially with a long list of instructions from that appointment that say something like, days 1 through 5, take 2.5 micrograms of Cytomel. Days 6 through 10, take 2.5 in the morning, 2.5 in the afternoon. And that titration schedule goes on for weeks so that we are able to accomplish about a year's worth of work in the first round of treatment. And what that translates to our patients, to you, is 95+% of people feel better after their first round of treatment. Are they where they'll be in the long run? Gosh, no. Like, we're not going to arrive at your perfect thyroid dose in your first round of treatment. We actually have to create stop gaps for safety so that we don't over medicate you. But people feel better in their first round of treatment. Their lives begin to get better the first few weeks in 95+% of cases. So that's not what happens everywhere else. Everyone else is guessing, like they're just winging it. And the way that I describe guessing with thyroid care is clinicians are throwing darts at a dartboard blindfolded, hoping to hit a bullseye, right? And if you end up a patient and your clinicians hit a bullseye, amazing. You should probably go buy a lottery ticket because you are one lucky human. But for the vast majority of everyone else, they're just waiting for that clinician, hoping they're going to hit a bullseye. And it's just not a good situation. So 2 other things that make us different, and then we'll move on. One is, guys, we value safety. We want you to get your lives back. We do not want to compromise your heart health, your stroke risk, your long-term health outcomes to accomplish that. Nor do we have to. You do not need to be grossly over-medicated to get your life back with a thyroid problem. That is not the way that we do things. And you know what, guys? More than any time in my career ever, people are coming to our practice literally on the verge of a heart attack or a stroke because they are so grossly over-medicated. And it's a scary time out there. There are companies who are run by people who you think are doctors who are not actually doctors, who hold absolutely no medical license, no formal medical training outside of like nutrition. that are painting a picture that they do have a medical license, that they know what they're doing, that they're formally trained in medicine, that they can prescribe medications. They can do none of those things, and they are grossly advocating and having other clinicians, which legally they are not allowed to do, over medicating people to the degree that it is actually unsafe. And that's honestly hard to do. Like, it is hard to over medicate someone with a thyroid condition so much that it compromises their safety, their heart health, their risk for stroke, all of that. And it's actually happening. We're seeing it almost on a weekly basis right now. So you guys need to be careful no matter where you go. You need to make sure that these people, one, have true medical credentials, two, know what in the world they're talking about, and three, have safety parameters put in place to protect you. I'll descend from my soapbox on that, but it's really been a weird, scary time over the last year to 18 months. Lastly, we take a functional medicine approach. We take a holistic approach. So you are never going to go to your endocrinologist and have them talk to you about reversing your Hashimoto's, about reducing the severity of your Hashimoto's, about reversing your Graves' disease. Those conversations are not had. They do not believe that you are able to influence your autoimmune thyroid condition in a positive way. They think it's random. And I'm here to tell you that's so untrue. So not only have we escorted innumerable patients to remission, even more have reduced the severity of their Hashimoto's, their Graves' disease, in an enormous, impactful way. I myself have been in remission for Hashimoto's for over a decade. I used to have what I would say is severe Hashimoto's. I used to have a goiter that was absolutely enormous, y'all. Haven't had Hashimoto's in well over a decade. So you want to find someone that actually is looking for root cause resolution as well. Do you need medication management? Absolutely. Do you need root cause resolution? Absolutely. It's hard to find people that do both of those. The flip side of the conversation is people online saying, oh, well, I'm going to help you with your root cause. Your thyroid problem isn't a thyroid problem. It's an inflammatory problem. It's an autoimmune problem. Is that all true? Absolutely. Can these people prescribe you medication to help you with your actual thyroid function? No, most of them can't, but they're not telling you that. Again, they paint a picture that they're a doctor, but you just don't need medication. This isn't a thyroid problem. We need to work on your root cause. And again, that's true, but you also need medication to complement that approach to be able to get your life back. You are not going to get your life back from only a root cause approach. And with medication management, you also need the root cause approach, right? So that kind of wraps up what makes us different and what I feel like, sets us apart. What we've created here is not like what anyone else has created. It is absolutely uniquely our own. So let's talk about who this is for and who this isn't for. Okay. So this really is for people who have tried the regular approach. They have been to their doctor. They've been told their symptoms aren't due to their thyroid, either because they don't have a thyroid problem, it's just mild and we need to watch it, or they're on thyroid medication already and they're being told their labs are normal. Their symptom, or not on medication and being told their labs are normal. Their symptoms aren't related to their thyroid. You just need to eat less and exercise more, kind of thing. So those are our people, right? We do not need to be someone's first stop for thyroid care. In fact, I encourage people, look, see what regular medicine has to offer. Maybe in the off chance you get better with it, great. But I encourage people to have that experience, know the limitations, come in as educated, informed, empowered consumers of their health, right? Who Modern Thyroid Clinic is not for is for people looking for a standard approach, right? We've had people, like I saw a review, one of our very few negative reviews is like something to the effect of, well, I came to Modern Thyroid Clinic. They started me on medication. I saw my primary care doctor and they were like, what are these people doing? Why are you on T3? Why are you on active thyroid hormone? Why are they checking all of these labs? I do not agree with their approach at all. Right. Like, we don't want you to agree with our approach. Our approach is not standard of care, like full disclaimer. And we even make people sign paperwork that says, look, we are operating outside of standard of care. those are the people that need us. Standard of care is not helping the vast majority of people in the world or in our country with thyroid conditions. They are leaving them lost alone out in the cold to fend for themselves with no hope, no solutions, nothing. And those are our people. Those are the people we want to help, the people that were just like me, being told this isn't your thyroid. Your labs are normal. Eat less, exercise more. Go on Lipitor as a 27-year-old woman for the rest of your life for your high cholesterol. That's actually just due to your thyroid problem, right? Those are our people. We don't want people to come here, pay us, give us money. If you want a standard approach and want levothyroxine, or you want to wait until your TSH is above 10 to intervene, those are not our people. And we want to serve our people, right? Our people are people who are invested in their health, who want to get their lives back, who want to learn and be empowered on their thyroid journey and participate in decision making and partner with us. This is not a, hey, this is what you're going to do because we say so, bye. No, like this is your health. This is your body. We want to be there to support and partner with you. Okay, I'm going to try and speed it up because I do want to answer y'all's questions. Sorry. Like really quickly too, things that we deal with at Modern Thyroid Clinic, right? So things that we help, I get the question all the time, well, do you do just thyroid? Do you do hormones? So we basically limit our scope to thyroid, autoimmune thyroid disease like Hashimoto's, Graves', hormone imbalances, whether that's premenopausal, perimenopausal, postmenopausal. We balance hormones and deal with hormone dysfunction literally better than anyone I know. Again, call me biased, but it's true. We get people transferring to us, hot mess, hormonally speaking, all the time. We deal with adrenals. We deal with inflammatory issues, autoimmune diseases, right? Just reducing inflammation overall, longevity, weight loss, metabolic dysfunction. Our weight loss program is so incredible. We are taking it nationwide under a branding of a sister company that you'll hear about more soon. So those are our things. Do we do primary care? No. Do we do infectious disease and deal with your respiratory infection? No, you got to see your regular doctor for that. So we always encourage you to keep your like primary care doc, etc. So I want to talk to you about our clinicians training. This also honestly sets us apart from other people. Okay, so we are taking Modern Thyroid Clinic nationwide. We are expanding from our original brick and mortar practice in Austin, Texas, to now in a lot of states that are in the chat window if you want to see what states we're open in. Do you know how many times we've been told to simply contract out a nationwide telemedicine practice to care for our thyroid patients? Too many to count. Do you know how many times I've said no? Every darn time. I am so incredibly particular about who we bring on, their training, their ongoing training. Our clinicians are rigorously trained in our model, y'all. Our whole goal is it does not matter who you see at Modern Thyroid Clinic, you get the exact same care. And that is the standard we hold our clinicians to. Not only do they train up front, we have ongoing twice a week clinical roundtables where we all meet, discuss cases, troubleshoot, talk about questions so that these people are continuing to learn on an ongoing basis. 4 times a year we meet and we do an intensive training. So these are not random people that are just, oh yeah, I'll work from home and see thyroid patients. That's easy. No, these people are invested in you, in your health, in your success, and your ability to get your life back. Also, every one of our clinicians has a thyroid problem. And you know what that means? You're not going to get treated like your symptoms are all in your head. Full stop, end of story. That will never, not one time ever, be tolerated in our practice. Our clinicians are female, they're all women. Every darn one of them have a thyroid condition of their own. They've experienced exactly what you are experiencing. They understand, they empathize, they know the reality of thyroid dysfunction, and it's the opposite of what regular medicine kind of treats it as, which is like, oh, this is common. It's not a big deal. You just take a medicine. You're overreacting. This is all in your head. It's not due to your thyroid. That will never happen here. So those are our people. I love them. Our team. And you'll see this, like if you read our reviews, everything from start to finish, from the person that you call on the phone, also being treated from a thyroid condition. The person in the background answering, helping us triage portal messages also has a thyroid condition. Like, I don't overtly weed out people when they apply, but it definitely factors into the hiring process because I want people to be treated like humans, like real people that are understood and seen and heard and are safe in our practice. So let's talk about logistics and pricing before we move on to questions. So I get a lot of questions all the time. Do we take insurance, right? That is, well, let's pause. Let's do a review, right? Amanda, I cannot say enough good things about Haley, about Modern Thyroid Clinic. I've been with them for almost a year, and prior to that, I suffered many years. She's given me hope and literally changed my life with T3 treatment. They listen and they care, and we do. They are intelligent and problem solvers. The website, I think she means like our EHR, is easy to use. Communication is wonderful, and I'm glad that I found them. I truly could go on and on. Well worth every single penny. And also much more doable price-wise than other specialists that I've tried to heal with. So let's talk about insurance, non-insurance. There's two kind of big things I want to highlight here. We work for you. Okay, you pay us for our time. We do not work for your insurance company. We are not invested in fitting in as many possible patients every day as humanly possible so that we can keep our doors open, which is what the insurance model requires. Okay, in medicine, we are taught to see people in 8 minutes. Okay, can you deal with complex thyroid disorders, hormone disorders, adrenal dysfunction, Hashimoto's resolution in 8 minutes? No, you can't. So what happens if you spend an hour with someone like we do on our first visit with your clinician? We get paid $38 to $60 for that hour. And there's no way that we can keep our doors open. And in addition to that, what insurance requires is that we do not run full thyroid panels. If we ran all the labs we run on everyone when we are actually trying to solve complex medical problems, heal your metabolism, fix your thyroid, insurance would come back and say, hey guys, if you keep running all of these labs, we're going to drop you from our policy and you're no longer going to be one of our providers because you're charging us too much money. Okay. No, we're not doing that. No, absolutely not. We are running what labs we want, when we want, as often as we want, as often as it takes for you to get your life back. We're going to spend the time with you that it takes for, again, you to be informed, empowered consumer of your health so that you can be educated, so that you can make informed decisions with us, but also long into the future. I want you to understand what is happening in your body and how to get your life back and how to maintain that. And all of that cannot take place in 8 minutes, y'all. It just can't. So we absolutely charge cash. Do we bill everything else for your insurance? Possible? Absolutely. So every time you get labs, we bill your insurance. If you don't have insurance, we connect you with a discounted lab. Every time we do a thyroid ultrasound, which you all should be having done, we bill your insurance. Okay. We basically try and take off any financial burden that takes place in medical care with the exception of our time. Okay. And additionally, of course, we take HSA, we take FSA, we do financing, right? So we try to offer all of these options for you all. Is it an investment in your health? Yeah. Do you know what is worth the investment of all the things in the world? It's not your car. It's not your phone. It's not your clothes. It's not your watch. It's your health. Especially guys, women. Okay. So if you can change the health of a woman, your work, my work, our work is generational because that woman, that you fix a woman, you fix a marriage. You fix a woman, you save a marriage. You fix a woman, you save a family. You facilitate their relationship with their kids, their ability to enjoy watching their kids grow up, their ability to show up as a grandparent. I truly do view, and I'm literally getting chill bumps right now because it's so true. I view the work that we do as sacred and generational because it changes lives for generations to come. And I tell you what's worth the financial investment. It is that because you can spend all of your money on all of these material things. And if you do not have your health, none of them are worth anything, right? If you cannot be out of bed, thriving, playing with your kids, actively participating in your marriage, your car is useless. And so is it an investment? Yes. Is there anything worth an investment more than your health? than your life, than your family, than your children? No. And that is the role that women serve, right? It is not an investment just in you, and women struggle with that. We struggle investing in ourselves. This is an investment in your family. And so many times I can tell you, women have come to us and they say, honestly, the only reason I came is because I don't feel like I'm the mom that I should be, right? And that is what is driving them to come here. And I am so grateful that I wasn't a mom during my own thyroid journey because I don't know how they do it. I had a hard enough time just being a wife and an employee, much less showing up for my kids and being able to enjoy them. So I think there's nothing better to invest your money in than yourself. And it is so worth it. And what every patient, not every patient, but a lot of people say is when they come to see us, they never regret spending the money. Like you can read our reviews so much of the time. People are like, this is the best money I've ever spent. This was such a good investment. But the one regret people do have is that they didn't call us sooner, that they've watched us on social media for 2 years, that they've followed me for 5 years, but they never actually called. And then they get their lives back and they say, God, I wish I did this sooner. And that's the truth. Like that is the God's honest truth. So, all right. I put some information in the chat window. I want to start to move towards answering questions. Here are so many reviews of our patients in the last few months. If you guys haven't seen our Google reviews, I encourage you to go. Like, y'all, these are your people. These are people that were in your exact situation. No one comes to us their first round. We are the last ditch effort, the last ditch resort for these people. And these people started like you and they get their lives back. And that is what happens here more than anywhere I've ever seen in the world of thyroid. So please go read our reviews, see what's happened in the lives of people who struggle exactly like you. Okay. So I want to answer some of y'all's submitted questions, and then I'm going to try to take some questions from you all live. The one offer that I do want to make to you guys is right now through December 1st, we are running a special on your intake appointment. You can save $75 on your first. There's 2 intake appointments, one with our health coach to go through everything, set goals, gather information, order labs, so that by the time our clinician has availability for you to see them, they have everything they need to start your treatment plan on day 1. So you can save $75 on your health coach appointment. We do not run specials. If you've been here for long, you know that. The code is the wait is over, and you just enter that when you book your health coach appointment. If you want to take your next steps, you can go to modernthyroidclinic.com/new-patient. I'll leave this up for a minute while I answer some questions in case you guys want to write any of that information down. So a lot of the questions have to do with states that we're in. I put all the states that we're open in the chat window and all the states we are about to accept new patients in. New York is actually any day now. We got a question specifically about that. So that's really good news. We're so excited. And we will be in all 50 states. We are a virtual practice, so you can see us from your pajamas when you're really tired or from bed. We don't really care. Show up however you want. You don't need to be fancy for us. We're in the business of giving people back their lives, so we know how this starts. We've all been there. So yeah, there is no brick and mortar practices anymore. You don't have to physically go to a location. You can see us from the comfort of your own home. Okay. How do we coordinate care with your primary care doc? Honestly, we're always happy to share records. We're happy to send records, get records. We're also happy to pick up the phone and talk with them. So PCPs, OBGYNs, cardiologists, anything. Like we are happy to, oh, Janet, okay, I'm going to need to exit out of this to maybe see your hand raised. Let's see, Q&A. Okay, cool. Okay, awesome. I'm going to keep going. Janet, if you could type your question in, that would be amazing. So yeah, we are happy to chat with your clinicians. Like whatever we need to do to make access to care better, more consistent, more cohesive, we'll do. I need to know if my medication is right for me. Yeah, so I would say if you're having thyroid symptoms, if you're fatigued, brain fog, weight gain, dry skin, brittle nails, brittle hair, high cholesterol, high blood sugar, loss of the outer portions of your eyebrows, heels cracking, depression, low libido, your medicine's not right for you. So that's, if it looks like a duck, quacks like a duck, walks like a duck, it's a duck. Everyone that comes to our practice is terrified that they don't have a thyroid problem, that their thyroid problem isn't driving their symptoms, that we can't help them. In all the years we've been doing this, there is one person ever that I've turned away and said, listen, this isn't your thyroid. Something else is going on. It was a gentleman. We refunded all of his money. I coordinated with him to help him go to next steps and find the right person for him. But y'all, thousands and thousands and thousands of people show up with those same fears and they leave with their lives back. So don't let fear that this won't work because things haven't worked in the past for you, that it's not going to work for you. It will, and it does. The code, yes, of course. So you guys are on the, okay, so yes, let me back up. Cost code. So the code is the wait is over. I think it's also in the upper portion of the chat. Cost, all of our pricing is on our website, y'all. Like, it's completely transparent. We're not hiding anything behind curtains. I am not really taking new patients right now. My goal is to get you all access all over the entire country with our clinicians. So my pricing is very, very high. You don't want to see me. It's purposely set that way so that you see the clinicians that we invest in constantly to help you so that I can continue to grow and reach more people so that we can help more people. But all the pricing is on our website. I've been seeing a doctor for several months and I'm not happy with the results. I just had a full blood panel done on Friday and I'm wondering if you could use those results versus me having to pay for a new test. So let me tell you, there are about 12 factors that go into making sure we collect lab data, and we get this question all the time, the right way so that on day one, your clinician can make effective decisions based on stable data so that they can then make a year of progress in one round of treatment, right? Their ability to do that is 100% entirely built on us having access to good, clean, proper data, okay? And when people collect labs elsewhere, when they're on anything with active thyroid hormone, when they're in the middle of settling for their medication, when all of these things happen, we don't have good data, and that makes us guess. We do not guess. That's what makes us better than your current clinician. So we need to not have to guess to do our job because that's what makes us better than everyone else. So if for any reason your labs leave variables up to our ability to effectively do our job, we would have you get another panel. If you're paying for your thyroid panel out of pocket and you don't bill insurance, which we do if you don't have insurance, we can get you a thyroid panel for $80. Like, don't let $80 cost you 4 months of getting better because we're not able to do our job well. In the off chance that everything is done perfectly, the health coach will find that out in your initial appointment. And then, yeah, theoretically, we could use your labs. That happens 1% of the time. And this is a huge barrier to people getting their lives back, is not collecting appropriate lab data well. And so, yeah. Do we prescribe microdose GLPs to a patient in a normal BMI for the benefits beside weight loss? Through Modern Thyroid Clinic, we do. We will not offer that through Modern Weight Loss, our sister company that's opening, unfortunately, which I'm still dealing with every day because the benefits of GLPs are absolutely insane. But maybe eventually we will be able to. But for now, we do offer that to our Modern Thyroid Clinic patients. Do we help with hair loss? Absolutely. I wish I had a picture of me with my hair. I lost like 90, 85-ish% of my hair with stress, like with COVID. And yes, we can absolutely help you get your hair back. We do that all day, every day, in so many ways. We influence hair loss in multiple facets because hair loss is extremely stressful for women, even if they can't function. They're like, even if I can't get out of bed, if you just make me not lose all my hair, I'll be happy. And so we approach that aggressively with every possible avenue so that we can halt that as quickly as humanly possible, because every darn hair that you lose takes like 5 years to grow back, right? Top 3 supplements I believe that we should take for Hashimoto's: selenium, glutathione, red light. My ferritin level is low. Can we help with that? Yeah. I mean, we're not like iron experts, but yeah, we see people with low ferritin all the time. It influences your ability to utilize and activate your hormones. Yeah, something we do a lot. How can we get medication which is available in the US but not available in the UK, for example, Armour? There are places that you can source desiccated thyroid in the UK. It takes a lot of research, a lot of advocacy finding the right doctor, obviously cash pay. The person in the UK that I refer to is called Country Health UK. I think his name's Oliver. He doesn't operate exactly like us, of course, but that's the closest recommendation I can get for y'all. I was diagnosed with adrenal fatigue and need to know if you can help with that all day, every day. Almost 100% of our patients have adrenal fatigue. Yeah. Is treating hypothyroidism different from Hashimoto's? Absolutely. Those things are treated in two different ways. They are caused by two different things, and they both need to be addressed independently. All right, I'm going to move over to these questions. I'm going to try and hammer them out and be short-winded. I had elevated thyroglobulin antibodies, but other labs normal, told nothing is wrong. Can nutrition alone treat Hashimoto's or thyroid conditions? Very much lifestyle influences your Hashimoto's. So thyroglobulin and TPO antibodies is very, very influenced by lifestyle, not by medication. However, if you have thyroid symptoms, you have likely hypothyroidism. You guys can be disabled before medicine will tell you that your labs are not normal. You can be bedbound, not functioning in your life, and medicine will look at you and say, your labs are normal, it's not your thyroid. And guys, it is your thyroid. Like, it is your thyroid. So do not ever, 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 ever believe someone when they tell you your thyroid labs are normal. It is the whole reason I release all of this information freely, openly online, our lab ranges, what labs we get. Everything I can share with you guys, I try to do so that you can say, oh, my doctor said my labs are normal, but my TSH is 4. McCall says that's not good. I need to find help, right? So that you're not like, oh, well, my labs are normal and now I'm just going to live like this forever, because I do not want you to live like that forever. You can't. I couldn't. Don't do it. Okay. High TPO, immunoglobulins, and RT3 as well as nodules, labs otherwise normal. Is that Graves' or Hashimoto's? That depends what immunoglobulins you mean. So Graves' antibodies are TSI, thyroid stimulating immunoglobulins, or TRAB, thyrotropin receptor antibodies. If you have those positive antibodies, I can't speak to you because this is educational only, but that is diagnostic for Graves'. You can also have Graves' and Hashimoto's simultaneously. 30% of people that have Graves' have both. There is not another place in the country that offers what we do for Graves', full stop. Okay. Period. Yeah. Do we do hormone replacement therapy, bioidentical? Absolutely. All day, every day. I'm on the verge. I've been following you for 8 to 9 months on Instagram and trying to figure it out. All those symptoms seem to ebb and flow, not as bad as many, but primary care gives impression I'm an old white woman with anxiety and stress. I asked for more tests, which is how I found out I have elevated antibodies, but still nothing's really wrong. I think sometimes I'm going down the wrong road thinking it's thyroid. Anonymous, you and every other person here. You and every other person here has been made to believe these symptoms are in your head. They are not a thyroid problem. That is what medicine has beat into your brain, and that is not true. Again, of all the thousands of people we've treated that all thought the same thing you did, everyone but one had a thyroid problem that was fixable, right? That one man, God bless him, I hope he found his answers. But everyone shows up thinking it's not their thyroid and terrified that that's the case, because that is what the 10 other doctors they saw before they saw us told them. I do not want you to believe that. Oh gosh, okay, I've lost my place here. Okay. Is desiccated thyroid the only T4 supplementation we recommend? No, we use combination. We do not have a one size fits all approach. So period. There is not one thyroid medication that works for everyone. We use desiccated thyroid. We use T3 only. We use a combination of desiccated thyroid and T3 like Cytomel. We use a combination of T4 like levothyroxine, Synthroid, and Cytomel. Each case is unique and has to be addressed in a unique manner to solve your exact biochemical issue. Where can we find the ranges your clinic finds to be normal? They're linked in all of my social media. So anywhere you can go and find that. Okay. Do you work with teenagers? Specifically, my son has Hashimoto's diagnosis and I'm looking for functional medicine help. We do. I think our age cutoff is 15, but it might even be lower than that now. But we do very commonly work with teens. Is it common to fluctuate between hypo and hyper after having your thyroid removed? My primary suggested a thyroidectomy because I kept fluctuating between the two. I wish I never would have had the procedure, I know, done, as my symptoms seem to get worse. Y'all, medicine dangles thyroidectomies to people and they promise them that life is going to get so much easier after, and life is really freaking hard. If you are, the only reason I would ever recommend a thyroidectomy to someone is with cancer or wildly uncontrollable Graves. And it is, I've only ever had that happen with one of our Graves patients. So do not rush to a thyroidectomy. It is not common to swing between hypo and hyper post-thyroidectomy. What's happening is someone is only checking your TSH and they're telling you you're hyper. They're telling you you're over-medicated, when in fact, they're just not looking at a full thyroid panel and they are throwing darts at a dartboard, blindfolded, hoping to hit a bullseye. Do we prescribe glutathione injectable? No, but we can connect you with someone like Ageless RX. If you guys want glutathione injectable is really painful. So it's something that some people will start and they do not continue it long. It hurts for a week. You inject it every week. The injection site hurts. It's not good. I'm recovering from SIRS. I also have all the symptoms you mentioned. Do I need to recover before I start? I know my thyroid and hormones are off per labs I just received. I only take testosterone, which has helped. I'm working on that too. Let me tell you, Marcy, go for the horse before you go for the zebra, right? Look for the horse at a farm before you look for a zebra, because you can fix SIRS, you can fix mold, you can do all these things. And if you have a thyroid problem, you're going to feel the exact same way. So you're dealing with this super complex, abstract thing where symptoms overlap with a very fixable, concrete problem. Fix this so that then you can know how much actually is left of SIRS symptoms, because you're never going to know what's SIRS versus thyroid until your thyroid is figured out. And a lot of your SIRS symptoms, I can't speak to you, but based on cases in the past, get better when you fix their thyroid, and probably less of your symptoms are related to SIRS than you realize. Can we do thyroid care and GLP-1 together? Abso-freaking-lutely, guys. One of my most sacred and exciting, impassioned journeys I have ever been on is leading my women, my thyroid women, through a weight loss journey using GLP-1s, through a journey to heal their metabolism using GLP-1s. It is I never thought I would be as passionate about something as I am about thyroid. And y'all, there is nothing that heals metabolism of people with thyroid conditions as effectively as a GLP-1. Absolutely. I love it. I advocate for it to no end. Could you speak to your education? I mean, absolutely no disrespect. Sure. But I see from your site, you do not hold an MD, but you clearly have experience and knowledge. Would love to know more about my BG and how your expertise and your staff, which is what you said is knowledgeable as you, is similar or different. Thank you. You're amazing. Yeah, no problem. So I'm a PA, right? I'm a physician associate, or what's now referred to, or a physician assistant, now referred to as a physician associate. There is no MD training. There is no endocrinology training. There is no PA training that will offer what we have here. Full stop. Medicine's training, and you can ask a doctor that you know, their training for thyroid is TSH, T4. Do not use anything except levothyroxine-based medications, Synthroid, Levo, Tirosint, etc. Full stop. End of story. If you use T3-based medications, you will give your patients a heart attack and a stroke. Do not do it. So you know what happens? Clinicians, physicians, PAs, NPs, everyone across the board does not know how to run a proper thyroid panel. They don't know how to interpret a proper thyroid panel. They don't know how to use any medications outside of levothyroxine-based meds. And that's the end of it. So you can go see an MD anywhere, and you can get, again, I want you to see an MD, an endocrinologist, before you see us. I want you to know exactly what they have to offer you before you look for something different, right? One, you may not need something different. Two, I want you to be informed on both sides of this spectrum so that you can make informed and empowered health decisions. So my education lies in a physician that mentored me, that gave me back my life. I took that foundation and I amplified it, and I analyzed hundreds, and still do to this day, hundreds of thousands of pieces of data of our patients that tell me this is where people have thyroid symptoms. This is where they don't have thyroid symptoms. This is what I can do to influence their antibodies. This works, this doesn't. And I, by nature, what gives me the ability and us to do our job effectively at MTC is I am a data analyzer by nature. I analyze data all day, every day. It's what for our GLP-1 program, our weight loss program, we are, y'all, 2 freaking years ahead of research that's coming out. I have been telling our patients for 2.5 years things that studies are just now saying. Why? Because I collect data, I analyze it, I recollect it, I reanalyze it. And that's what makes me different than everyone else. I'm not learning. We are not learning from what someone else is teaching us. We are learning and evolving the thyroid treatment paradigm in real time. We are making connections for pharmaceutical companies, studies that are being done, drugs that are coming out to try to push this evolution of thyroid care forward, because you don't want what is already offered. If you do, go do it before you come to us again, because that is what you're going to get. Synthroid, TSH, T4, a life condemned to thyroid symptoms. We cannot work with people in Canada. Sorry. I'm on Tirosint and labs are normal, but I'm still very tired, have hair loss, and now high cholesterol. Didn't know that was a thyroid symptom. Absolutely. What are Modern Thyroid's optimal labs? Again, they're linked in all of my social. Carl could probably also drop them into the chat window. Have you experienced treating recovery from acute thyroiditis? For sure. Acute and chronic, both of them. I'm a 71-year-old and had my thyroid removed at 30. Does this fit into your scope of practice? Absolutely. We take people in their mid 60s and up, we take it slower with them because you all are at risk for AFib more than younger people. So we just take a little bit longer, but we absolutely treat you guys. I had the most darling patient who's 77 last week who started with me a year ago. And she's like, you just completely changed. She's such a fun, spicy, like on fire woman. Completely has her life back, y'all, as a 77-year-old woman, thriving, working like 60 hours a week, loves it, active in her family. She's like, I will never be able to thank you enough. So absolutely, we do that. My ENT wants to remove my thyroid for multinodular goiter. Biopsy came back clean. I don't really want to remove my thyroid unless I absolutely have to. Are there options? So again, I can't speak to your medical case because this is education only. Do not get your thyroid removed, in my opinion, for any reason outside of cancer or treatment refractory severe graves. There is something called radiofrequency ablation that can deal with large or small benign nodules where you still get to preserve a lot of your thyroid function. When I take T3, even just 15 micrograms, my TSH is almost 0. So first of all, T3, 15 micrograms of T3 is not a small dose. That's actually pretty robust. And the protocol is, our approach is, we don't mind if your TSH is low as long as it's not unnecessarily suppressed. So if you have all this excess T3 or T4, we don't want your TSH low. We'd rather balance these and see if your TSH can come up. There are research shows 35% of people, I estimate it to be a lot more, that their TSH does not correlate with their output hormones. Those two things are not integrated. I see that all day, every day. So we will not make you hypothyroid in order to raise your TSH, because that's not doing anyone any favors. How do I work with someone in Colorado? We are in Colorado. You can just click the link in the chat window, and we have quite a few clinicians open in Colorado. What are your thoughts on HRT? I was put into medical menopause, and it's hard to know which symptoms are menopausal versus thyroid. I love HRT. We have a conservative, very effective approach to it using bioidentical hormones. I think a really seasoned clinician most of the time can tease out, our clinicians for sure, can tease out thyroid from hormone dysfunction symptoms. They actually present differently than you would imagine. 27 years ago, while pregnant, I was told I had Hashimoto's and my thyroid would burn out. I've been on Synthroid for the entire time, currently at 88 micrograms and still feel bad. The last test I had for antibodies was 2 now. So do I still have Hashimoto's? I'm in menopause and have weight gain around my middle and can't get rid of it either. Yeah. So it's hard. I don't know which antibody was 2. If it's thyroglobulin, it means you do still have Hashi. If it's TPO, you do not. And yeah, you're a classic, what I call a poor converter. So someone that's on Synthroid, levothyroxine, Tirosint, I give an analogy of crude oil, y'all. We're giving you crude oil. We don't put crude oil in your car. We need it to convert to gasoline to make our car go. If you can't convert that crude oil to gasoline, you're not going anywhere in your car. And Synthroid, levothyroxine, that's all crude oil. You got to be able to convert it. What we really advocate for is give you some gasoline too, so that we can balance that. I keep hearing that GLPs cause muscle loss and weight as soon as you stop them. Yeah. So yes, if you do not eat food, you do not move your body, you do not lift weights, and you starve yourself, guess what? You lose muscle. If that's not GLP related, that's independent of the GLP. If you are on a GLP and you eat protein and you get your micronutrients and you move your body and you lift weights, guess what? You build muscle. There is no magic involved. And we have people, 95+% of our people in our weight loss program successfully come off our weight loss program. We have a very, very particular protocol to ensure that metabolism is healed so that they can appropriately maintain weight and lose weight in the future. We don't openly share that. It's still held quite closely because other people don't have access to that data. But it's very possible. Y'all hear so much of a one-sided story on GLP-1s. If you haven't tuned into our podcast, I released 2 podcasts recently about GLP-1s. We're going to have a couple more coming out in the next few weeks. Modern Thyroid and Wellness. I encourage you to check it out. We do deep dives of real information and not like sensationalized media. Okay. Miriam, it's up to you if you want to wait or drive to New Hampshire to get started. I do think Massachusetts, so this is our really short list. I think it'll be in a week or 2. So I think you won't have to wait long. All appointments will be virtual for sure. 70%, we got a question about nodules. 70% of people have nodules. 5% of those are concerning for cancer. So it's very common to have nodules, very much uncommon for them to be concerning, very normal to monitor them via ultrasounds. How do you know if you're not converting T4 to T3? You test, you get data, you get labs. Also, if your symptoms, if you're on Synthroid and you have all the thyroid symptoms, going up and down in that dose most often is never going to solve that problem. I'm sure so many people can vouch for that here. You need something that's going to support your physiology better. Okay. I don't want to answer specific lab questions right now, y'all. I'm sorry. We have lives that we do that, though. You guys can totally hop on. How is high cholesterol related to thyroid? Early indications of thyroid dysfunction are elevations in your blood sugar and cholesterol. Your thyroid slows your metabolic function. It's what causes weight gain. It's what causes prediabetes. It's what puts you at risk for heart disease and high cholesterol. It's what made the doctor try to put me on a cholesterol medication at age 27 for my thyroid problem. Okay, guys, I think I'm trying to be so respectful of y'all's time. Okay, closing. Our lab's covered by insurance, absolutely. We bill your insurance for absolutely everything except our time. And I didn't say this earlier, but you can submit a super bill to your insurance for out-of-network reimbursement. That varies, like the coverage per insurance policy, so we're not able to predict what that is, but some of them cover nothing. Some of them cover 85% of out-of-network visits. So that's always an option too. Thank you guys for coming here. Like, thank you for showing up. Thank you for taking the time out of your day to invest in your health and get empowered. I want you to make informed, empowered decisions, whatever they are. And I hope this facilitated that. We are here for you at Modern Thyroid Clinic. If you need us, again, we have a special. The code is The Wait Is Over. It runs through December 1st for 50% or $75 off your first health coach visit. We are wrapping up the year. You need to use those HSA dollars. You need to use those. If you do need to use the FSA dollars, do it. Like, we can set you up for holidays to enjoy them, to thrive, to not exit them 10 pounds heavier than you went into them and never be able to lose those 10 pounds, right? So I heart you guys. Thank you for being here. I hope that this was enlightening for you, and I hope that we can help you on your thyroid journey. And never forget, always remember, there is no reason to still have thyroid symptoms, and don't let anyone tell you otherwise. Be well.